Now with Rehad Desai, he's the spokesperson for the People's Vaccine Campaign. Unfortunately, had a bit of signal issues there, but it seems that everything is okay now. So, well, yeah, let's get back into the conversation. So, you've been having a look, seeing the access to the vaccine for a lot of South Africans. So, I suppose my question to you is, how are we doing? How is government doing in terms of the rollout and getting it? Obviously, we know here in suburbia, you know, you can get it. It's easy to access. But when you're not living in a city and the access isn't easy, what is it like?
It's what we're seeing is in informal settlements in particular, we have a problem. In some of the rural areas, many of the rural areas, there's still a problem. It's not being communicated properly when the vaccine sites are going to be open, how long they're going to be open, where they are. Often we have a situation where the vaccination, the nurses and the workers and so on at the vaccination sites are sitting there waiting for people. And I think we need to be more proactive in getting out, you know, when these sites do pop up, that the communities are involved. And most importantly, that the churches, the community-based organisations are met with and communicated with and brought on as partners. Because what we're seeing now is a plateau when our numbers aren't increasing. In fact, the daily vaccination rates, despite the fact that we have more vaccine sites, aren't increasing, they're plateauing. And that's a very worrying sign for government. I think government understand this and they're attempting to do this through a programme to ramp what they're calling accelerating demand. And we've got to accelerate demand because you mentioned the figure of 85,000 official deaths. The Medical Research Council says there's been 250,000 access deaths and 200,000 plus of those deaths can be directly related to COVID, which means that we've nearly had 300,000 deaths today. And these deaths are occurring amongst people who are unvaccinated. That's not to say that people who have been vaccinated are not being admitted into hospital with serious illness, but it's a very, very small percent of those people that have been vaccinated, fully vaccinated, that is, that are getting seriously ill or indeed getting infected with COVID. So
it seems the biggest responsibility.
We need a more rigorous campaign.
Yeah, and that's where sort of the responsibility appears on government's behalf to get trust within South African citizens, to get them to vaccinate. But you know, it seems that that's where the problems come in. I mean, you see a lot of mandatory vaccinations taking place in other countries around the world. In fact, I mean, if you just look at neighbouring Zimbabwe, I was reading some stories where civil servants, teachers, I think they've made it mandatory that they do get vaccinated. Here in South Africa, besides some businesses, I mean, we talk Discovery, Sanlam, other companies, I think, coming up with the same policy that they have to get vaccinated, their staff. But from a government perspective, they're still saying, not yet. We're not going that route yet. People must choose. What are your views on that?
Well, I think we can go the mandatory route, but certainly for congregate settings where we, you know, find a lot of people under one roof, like gyms and even churches, some big churches and other restaurants and so on. And I think that this is important, but you can't do it until you've got a number of things in place. And one of them is that, you know, we have a free and comprehensive service for healthcare for those people who are having adverse effects to the vaccine. And that's got to be communicated to people. Yes, people, you know, it's essentially the individual versus the collective rights. So where we have a situation where individuals are putting their individual personal right not to be vaccinated over and above the welfare of the collective in a setting where it's clear that they can infect fellow co-workers or other residents citizens, then we have a problem. We have to prioritise, I think, the collective over, and I think we can't actually do that until everybody has had fair access to the vaccine, all over 18-year-olds. And that will mean at least 2-3 more months where we can get to a situation of, hopefully by the end of the year, December, 50% of our population have been vaccinated, and everybody's had ample time and opportunity to get vaccinated. Yeah. And that means big employers giving time off for workers. We know we've all got busy lives, we've got children and so on, other obligations we have to meet. So a bit more time, because the rollout has been slow. It started late.
Yeah. All right, I've got to leave it there, unfortunately. But thanks so much for talking to us here on the programme. And just talking to vaccine, getting the word out there, regaining or gaining the trust of South African citizens to know that this is the right thing to do. But that's up to you, and of course the education and what you hear and what you read and what you feel about getting this vaccine. Rehad Desai is a spokesperson for the People's Vaccine Campaign.
That's all we have time for this morning. We're going to have to leave it there. Please be safe. Please take care. We'll see you again tomorrow morning.